Hello, I am presenting patient John Doe. He is an 85-year-old man. He has a medical history of hypertension, gout, prostate cancer, osteoarthritis, obstructive sleep apnea, hyperlipidemia, and he has bilateral hearing loss, and he reports today with the chief complaint of possible shingles. History of present illness. So he complains of a lesion on the right side of his face. It's just in front of his ear. He also has a couple of spots on his back and on his neck, right at the hairline, as well as a single spot on his right forearm. He does report itching and a burning pain. That sensation's been there since last Thursday. He notes that there was a fluid discharge several days ago. He reports having had shingles before. He notes that he put anti-itch cream and it seemed to help with the itching, but the burning and pain was still present. In addition, he did have his shingles vaccine 2 weeks ago. Okay, so for review of symptoms, with skin, as mentioned, he had bilateral reddened lesions on the side of his face. He originally had reported just the right side, but on observation it was also present on the left side in front of each ear, and they were arranged in a pattern that kind of follows the expected path of the trigeminal nerve. There were a small number of vesicles visible in front of the left ear. There's a similar lesion on the right forearm, and there were no other skin concerns. So for cardio, patient denies any chest pain, dyspnea, palpitations, or edema. Even though he has hypertension, his blood pressure today is 122/71 with a regular heart rate of 78, and he does use his CPAP as directed nightly. Respiratory, he denies any shortness of breath, cough, or wheezing. Gastro, denies any abdominal pain, no nausea, vomiting, diarrhea, or constipation. Genitourinary, he does follow up with urology annually, and he's post-prostatic cancer. He does have current benign prostatic hyperplasia, but he denies any new dysuria, increased frequency, or urgency. Musculoskeletal, he does have osteoarthritis, specifically bilaterally in his knees, but the pain is stable with periodic corticosteroid injections. He denies any new occurrences of stiffness, weakness, or swelling. Neurologic, he denies any history or any problems with headache, seizure, syncope, or numbness or tingling. Family history is positive for cardiac disease, both maternal and paternal, with both parents deceased following MIs. My assessment and plan. John's report of burning and itching and pain are suggestive of herpes zoster, while the presentation being bilateral is somewhat atypical, with spotting versus clear lineated lesions. It could be that the recent vaccination has offered some immune response and is preventing him from getting just an all-over case of shingles. Other considerations would be contact dermatitis. He's prescribed valcyclovir 1,000 milligram tabs. The patient's to take 1 tab 3 times daily until the prescription of 21 tabs is completed. Should take 7 days. Pramoxetine moisturizing lotion 1% is to be applied to the affected areas just for supportive therapy. He's to follow up as previously scheduled or before if needed. And in addition, I'll call the patient in 3 days just to check for improvement. And if he hasn't got some improvement by that time with the antiviral, I would probably schedule him to be reevaluated, and that's it.